Hi, my name is Jacqueline Gerby, and this is my Change Project. The aim of my Change Project is to reduce the number of falls on my unit by 50% by increasing communication techniques among team members over the course of 6 months. According to the Joint Commission, one of the most common contributing factors to falls with injury is communication failures. Why do we want to decrease the number of patient falls? Falls have a deep impact on everybody involved, including patients, family members, staff, and the organization. The impact on patients may include increased morbidity, increased length of stay, decreased quality of life, and decreased satisfaction. After a fall, patients may also require rehab services. Patient falls can not only have a physical effect, but also a mental effect on patients. This may result in a psychological fear of falling, which hinders their everyday lives. For family members, a fall can create a lack of trust with staff and the facility. They may be fearful to leave the patient alone, leading to their own increased stress and fatigue. For the organization, it creates a poor public image. According to the Center of Medicaid and Medicare Services, falls are a hospital-acquired condition, meaning that hospitals do not get compensated for treatment when a patient experiences a fall. For staff, they may express feelings of sadness, disappointment, and stress after a patient fall. Nurses also often feel responsible due to this being a nursing-sensitive indicator. Falls can range from minor falls without injury to serious falls that are devastating and life-altering to the patient. Individuals have a 10 to 15% decrease in life expectancy and a decline in quality of life after a hip fracture. Evidence from the literature indicates that interventions aimed towards increasing communication and decreasing patient falls include bedside report, falls wheels, and hourly rounding. A falls wheel is a visual communication tool of a patient's fall injury risk for all healthcare team members placed on every patient door. This is used to increase communication among all team members and categorize patients based on their fall and injury risks. It also contains interventions tailored to those risks. For instance, a patient will be considered a high fall risk due to altered mobility, an altered mental status, or a history of falls. They may be considered a high injury risk due to risk for bleeding or risk for fractures. This tool is meant to be updated every shift or if there is a change in a patient's fall risk assessment so that it is up to date. In a study of 2015, the use of fall wheels reduced falls with harm by 48%. Bedside report is another intervention used to reduce patient falls. This leads to an increase in nurse-to-nurse communication and allows for both the oncoming and offgoing nurse to visualize and assess the patient together while including the patient in the plan of care. It gives the opportunity to assess the patient and the environment for fall risks and identify any changes in status that may lead to falls. A 2018 study found that patient falls decreased by 24% with the implementation of bedside report. Hourly rounding can also be used to decrease patient falls. This leads to an increase in nurse-to-patient communication. Hourly rounding includes assessing pain level, need for toileting or eliminating, assessing of the environment including room temperature, proximity of personal items, safety hazards, and positioning of the patient. A year-long study in 2015 found that implementation of proactive hourly rounding decreased falls by 57.7%. The expected outcome of my project is to reduce the number of patient falls within 6 months by 50%. The reason that I chose this as my Change Project is that my unit had the third most falls out of any unit in my hospital for the period of January to June 2018 with 17 falls. My unit is an oncology and neurology unit where most of the patients are fall risk, and the nurse-to-patient ratio is between 1:5 and 1:6. The implementation of my change project will include an interdisciplinary approach requiring collaboration with physical therapy to assess fall risk and improve patient strength and stability, collaboration with nursing assistants to complete hourly rounding, and collaboration with nurses to increase compliance with bedside report. It will also require an elected member of the unit to join the Falls Committee. They will attend monthly Falls meetings to address what is working and what is not working on each unit, and be responsible for educating staff on the unit for the findings for the previous month. What actually happened? Before implementing my change project, my unit had 5 falls on the unit in the month of May. My unit had the second highest number of falls hospital-wide for that month. Through implementation of my change project, there were only 4 falls in June and then 2 falls in July. I saw an increase in hourly rounding, which contributed to a decrease in falls, as well as an increase in patient satisfaction. Falls wheels also resulted in positive communication, especially between nurse and nursing assistants. There was also positive feedback from team members regarding the Falls wheel. Evaluation. There is still work to be done to ensure that Falls wheels are updated every shift or if a patient experiences a change in condition. There is also still some non-compliance of staff members regarding bedside report and hourly rounding. In order to complete my change project, data needs to continue to be collected over the period of 6 months to determine the effectiveness of interventions. And the Falls Committee must continue to monitor data among units and eventually institute interventions hospital-wide. Thank you for listening. That concludes my change project.